Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Transformation zone or zone. Transformation zone or squamocolumnar zone is a place where columnar epithelium of endocervix changes to squamous epithelium of exocervix. Transformation zone or squamocolumnar zone is the most common site of carcinoma cervix. It appears pale on per speculum examination. Transformation zone or squamocolumnar zone lies at the level of external os. It is not fixed. This external os is not fixed. It lies at the level of external os. External os is actually a dynamic point and the position of the external os keeps on changing based on the hormonal status. In all
Actually, the dynamic point, that is the transformation zone, is the one which keeps on changing. It is this transformation zone is the dynamic point.
females, metaplasia is seen at the transformational zone, which is physiological, and this transformation zone is physiological and it is not pre-malignant.
This metaplasia is physiological, not premalignant.
thank you and thank you for watching.